the latest development and latest technology, we are here to celebrate robotic surgery. Robotic surgery has made every major operation as a moderate or a minor operation. That is the difference it has created in our life. So today, I would like you to kindly follow me through these few slides so that I can give you some information wherein you can know something new of the medical science. Mr. Toastmaster of the day, fellow Toastmasters, and honorable guest, good evening and Assalamu alaikum. What is a major surgery? As in a medical case, I am not talking about the accidents. You open the skull, you open the chest, or you open the abdomen. This is major surgery. And there is, whenever these three part of the abdomens are open, one thing is sure, that the patient is going to stay in the hospital for a long time. The other thing is sure that possibility is that there will be blood loss and maybe you have to prepare your members to donate blood. And number three, the most important is the finance. Possibility, the finance will cost you whatever saving you have done in the last 1 decade in just one major surgery. But as far as the robotic surgery is concerned, I will just go according to few of the steps. One is the introduction, wherein I would like to give you few of this brief history, how it came into existence. Second is the advantages what we have of robotic surgery over the normal surgery. And the third part of it will be the type of robotic system which is beyond the scope of this audience. So I would just like to complete the topic by mentioning and showing you some figures in this part. Now let us see the introduction of it. Robotic surgery, every time whenever we are doing in any profession, you are dealing with some of the other instrument. And then suddenly you think, if I would have done something like this, maybe it would be better. And then you start working on it. Any enthusiastic person, any innovative person will like to do that. So does the robotic surgery came into existence. They started, and the instrument which we used to do it, they tried to take the technology from the neighboring field, like IT, into their own. And thus, robotic surgery, the robot which we talk about usually, has come to some way into the medical science. This robot is not necessarily a complete robot. It is just initially a part of a robotic hand which comes. But the human person is the main person who is guiding the robot. The robot alone will not be doing the surgery. Otherwise, the result will be very, very difficult. The current robot which has the application, it can do it because whenever a person is speaking, the robot may able to. Now if you see the mobile, the Android type, the smart mobile, whatever you do, even the mobile can recognize you as the owner. So similarly, the voice of the surgeon can be heard and that robot can do the thing. If you say go in the backward direction, go in the forward direction, the robot may do that in the latest part. Besides that, the robotic arm is very important because it is a mechanical. It never gets fatigued and it can move 360 angle within a short gap. These three things of the robots help us to make the operation much easier. Now as far as the history is concerned, robotic surgery came in stepwise. Initially, it was used as a fixator. Means if you want to drain, it was used in the surgery of brain. If you want to drain something and every time you have to put the drainage tube, they fixed it with the robot. If you want to have a light in a particular direction, they put a light as a robotic hand. And then while doing it, they can move the light of the robotic hand. So similarly, initially it was just a fixation. Second time, then it goes more in advance, and now in 1985, it was used initially in the brain surgery again. But the exact robotic surgery which was doing the surgery or part of the surgery came in 1991, which was again April 1991, which was again in the brain tissue to remove a part of the brain. The part of the brain is a small procedure, a small opening we have to go, and we have to remove the precise portion, because a millimeter here and there will make the person paralyzed. So this was used initially, started initially with the brain surgery. But then now we have the advantage of it. The advantage openly says that since it is a robotic surgery, we have a small incision. We have, with the small incision, the chance of destruction is less, the chance of blood loss is less, and the chance of healing is faster. So, robotic surgery does not require much incision and cut. Smaller incision, less pain, faster recovery, and easily discharged within a couple of days. If you want to have a picture by which we can have able to understand this was the open heart surgery. This is how the incision used to be done initially from the top. They used to cut down the sternum completely, and then they used to retract, and there the heart is exposed, and they used to do the open heart surgery. But now it has reduced. They just make 3 small holes. With the 2 holes, the 2 hands of the robots goes in, and with the 1 hole, the camera goes in. And you can monitor it on the screen, and just by doing the manipulation on the computer, you can do the surgery. So only small hole which has a couple of stitches can be closed, and the person can be discharged a couple of days later. But in open heart surgery, it requires long time. Now, as far as the advantage to the surgeon is concerned, robotic surgery has removed major part of the assistance required. There used to be a main surgeon, then there used to be 2 to 3 assistant surgeons, then there used to be an anesthesiologist, then every assistant surgeon has 1 nurse for him for giving instrument, and so from a dozen of assistant, it has come to 3 or 4 maximum. So definitely cost of the operation has reduced. The time taken for the operation has reduced, and it is done in a very much magnifying field. A small artery which is not easily seen is magnified 100 times on the screen, and there you can do the surgery. You can see each and everything very clearly without doing a mistake. The margin of error therefore is reduced to negligible. So this few of the things which is very important for as far as the surgeon is concerned. If the surgeon who can play games very well, he will be the best surgeon, because he can do the robotic, he can control the robot very fast and very well. As far as the cost efficiency is concerned, definitely stay in the hospital reduces, blood loss is not there, the number of medicines reduces, number of assistant doctors reduces, so the cost of, except for the instrument which is the robotic machine, which is costly nowadays, the other thing is minimum. So robotic surgery is always advantageous as far as the finance is concerned. And so far we are getting the technology. This is an extra advantage that today what we are doing a robotic surgery will be much better and much easier tomorrow. Now, general layout of the robotic operation, I would just like you to concentrate on this photograph. This is how the surgeon is separate the patient is somewhere else and 2 or 3 person is doing the surgery. Now as far as the hand is concerned, if you see the hand movement, it will be a round and a big area required. And if you see the movement of the robotic hand, it is occupying very small area. Now as far as the patient is there, it is separate, in the separate room, nobody is there near the patient. The surgeon is sitting here and the assistant is sitting there. There is a big screen there. Even the patient's relative can come and sit in the gallery and they see the operation entirely on the screen. So this is something. Now as far as the robotic machines are concerned, we have the ESOP robotic system which have only one hand. The second is the Da Vinci surgical system, which is the most used machine now, and the latest one which is added now. This is a surgical Da Vinci system, and the last is the Zeus robotic surgical system. This is the latest. It is not like that every machine you can operate anything. The machine also has a specific scope of certain organs and certain operation only, because it has movement and it has also going to do it that particular operation in a better way. So slowly we are trying to improve upon the machine, and maybe one day one machine will come in the end which will be a common machine for everyone. So my dear friends, robotic surgery is something which have a good scope in the future. With this, I would like to hand over back.